Well, good evening, everybody, and welcome to this evening's webinar on how to best prepare for your interview. It's very much focused at core training interviews, which obviously are in the offing in January. The next slide, please. So we've got a panel of both some experience and training representatives from BOTA and from ASIT, and their experience is obviously much more up to date than either myself or Miss Vig. Unfortunately, Stella's stuck in traffic and has got problems with computer at a hospital. Hopefully she will join us. But I'm Bill Allen, Member of Council, and like to introduce my two colleagues, Natasha Keats, ASIT representative from the Southwest Programme, and Graham Finlayson, who's BOTA representative from Northern Ireland. Next slide, please. So there we are, that's sort of self-explanatory. Next one, please. So what we're going to do is to go through some process issues relating to selection in the coming year. And then Graham and Natasha are going to go through top tips, and particularly not only around the nature of the interview itself, but with reference to the world we now find ourselves in when we're having to do things virtually. I hope many of you have got used to the idea of looking at yourself on a screen and talking to the screen without much feedback. It is challenging, and I think it's a new skill that perhaps we're going to have to get used to. And you may well have done video conferencing with patients, which is also quite an interesting way of working. Next slide, please. So from the process point of view, as you will, I hope, have been able to go through the application process. But from the timeline perspective, the interviews are planned towards the end of February, beginning of March. Now, there are some differences this year. It is anticipated that there will be a need to do more of a shortlisting than in previous years. This probably reflects the greater number of trainees who will be applying. Long listing in the past has been very much ensuring individuals meet a very broad list of essential criteria. So as a result, most people will get an interview. Because of the nature of the system, the shortlisting may well be of note, because it, by design, is going to require fewer opportunities for interviews, reflecting the virtual scenarios in which we're working. The other thing that's different this time will be the self-assessment, and this is something that has been contentious. Self-assessment against a set of criteria came into practice in the summer this year because of the problems of getting through face-to-face interviews for selection, particularly in higher training. And HEE, who oversee the selection processes, are very keen to use self-assessment as part of the process. Now, in surgery, this is relatively new, in as much as in only 3 specialties, trauma and orthopedics, urology, and OMFS, has self-selection been validated, and the other specialties have used it. And there was the way in which it was validated this year was based upon looking at the best performers, those in the middle, and those who performed less well, to see if that did correlate with the self-assessment outcomes. So this will be part of the process for this year. It will, of course, be based upon an interview technique via the Teams process, and the panels will be asking questions in the standard format around clinical issues, management issues, and of course the portfolio. Next slide, please. The applications close next week, and it's anticipated that by going through due process, offers for core entry for the summer will be made during early May. I think that the interviewers will have some challenges as well, because having to learn how to do interviews online. It is different, and there's some etiquette, if you like, that we have to get used to in terms of how that's done. And I think that's what we will discuss with you in the remainder of the talk. So I think next slide is for you, Graham. Next slide, please. Yeah, over to you, Graham.
Thank you very much. So what I would start by saying is that you have to remember that even though your interview is over the internet and slightly different from what people have experienced previously, the fundamentals of the questions that you're going to be asked are not going to have changed a great deal from the previous years. So I would encourage you to treat it like you would any other interview or exam. And in my experience, I have found interviews have gone best when I have treated them like exams and I've revised for them. And crucially, treat it a bit like a medical school OSCE and practice speaking your answers out loud. That's one of the most important things, and we'll come back to that a little bit more. The tip to book study leave is really about preparation. And again, that comes back to how you approach an exam. So preparing for an exam, you need time to do that. So speak to your colleagues, your consultants, and ensure that you have the time to take off to revise, ideally with someone who can help you, because an interview is a talking exam and you have to practice talking to someone, even if that someone's on the other side of a screen. And that allows you to have the best opportunity to speak smoothly, confidently, and crucially slowly, because being easily understood over an internet connection can be hard. The preparation bullet point there mentions a number of areas, and you know that these are what you're going to get asked questions on, because as I've already mentioned, they're the same questions that have been asked in the past. And learning from others, particularly your slightly more senior colleagues who have just undergone the process, is a crucial part of being successful in this. And from my personal perspective, whenever I have gone through an interview process, both at core training and subsequently at registrar training, and then most recently for fellowship applications, I had to practice with senior colleagues within my training schemes who had been through that process as well, because they were able to sit me down and work on my answers. And that was really essential. And they were also great sources of information. And that helps with the next bullet point, which is to find out as much as you possibly can in advance. Although the fact that you're logging into this webinar suggests that you've already identified that as an important part of your preparation. To come back to practice, everything that you do is about sounding smooth. And whenever I talk to medical students, I often say, oh, you don't need to know all that much to pass an OSCE, but you need to deliver the information really, really effectively. And I would say that's probably the same in an interview tip, because you can be reasonably certain what people are going to ask you. If you practice that well enough that the information comes out beautifully, then you're going to come across much better, and you're going to score higher marks, and you're going to feel better throughout the process. Being well practiced allows you to be confident, and it also means that if something goes wrong, you can fall back on the fact that you know what you're doing. And that's really, really important, because if you can stay calm and confident, you will do better. Part of that practice and preparation as well is that you need to know what you've written down, because a lot of the questions that you might get asked might be about your personal application. For example, tell me about time that you changed practice within your unit. And that's something that you need to refer back to the application that you've written. So if you don't know that well and you haven't practiced your answers based on what you've written in your application, that will probably show up. And I'm sure Mr. Allen and Natasha probably have some other points that they would like to raise based on that slide, because we really, when we were discussing this, felt that this is the key meat of this presentation. And this idea of practice, preparation, and crucially talking through your answers is something that we really can't emphasize enough.
Natasha, have you got any specific points to add?
Just to reiterate from my own experience, to completely agree with Graham, I've done registrar and core surgical training interviews, and I did not approach my core surgical interview as well as I did for my registrar one, and my experience and comfort was vastly different. Treating it as an exam, practicing with colleagues and seniors just made everything far easier, and I came over much better, and therefore I performed much better. knowing your application is also a very important thing. If you have taken some years out and therefore have a lot more in your portfolio to think about, like I did, you will be asked about those things and you need to know straight away what was your role in an audit, for example, what was the main change, what department was it is, what hospital, if you've worked in multiple places. So I just want to reiterate those 2 points because they made a very big difference to my experiences between the 2 applications.
I wonder if I could say, when I was revising for my core surgical interviews, I did a lot of that with colleagues at the same level. And when I revised for my registrar level interviews, I did a lot of that with colleagues who were a level above me. And the difference in how hard they pushed me in my answers was quite astonishing. And I really emphasized what Natasha said, that I felt much more comfortable. I almost would go to say, as far as saying that I enjoyed my registrar interviews, because every question they asked me, I felt like I was confident in how I delivered my response. And that really is an empowering thing. And if you're at the stage where you feel you're enjoying your interview, you probably are doing quite well. And that's what you want to get to, but you only get there with practice from people who will push you harder.
One of the things both interviewers and examiners look for is to ensure that when you're giving an answer, there's some structure to it. And for an exam, for example, you're asked about the cause of something, using a classification is a very good way of answering it. It gives the examiner confidence that you have thought through sensibly the answer to the question. Graham and I were talking about this earlier. There's obviously some various things available on the web about preparation for interviews. And there's a number of different tips about how you answer specific questions, because the nature of the combination of clinical, management, ethics, you've got to adopt a slightly different approach for them. And I would recommend that you can look for a number of these which go with some mnemonics. So, for example, a competency-based question about your leadership skills, you can answer that using the mnemonic which is called STAR. So that's situation, which gives the context, the task and what you were required to do, the action, how you demonstrated what happened, and what you did, as like Graham said, what role you fulfilled in the audit. And the R of STAR is explain the outcome of your action. So it gives the interviewer a very good feel that you have a sensible and logical way, rather than answering a question and coming out with a whole host of things in a slightly disordered manner in the heat of the moment. And I'm afraid we've all been there and found we've answered a question and given an answer and think halfway through, crumbs, I should have said that first, because what I'm saying is, as they say, it's the right notes, but not necessarily in the right order. So I think it's recognizing, it's trying to find ways in which you can formulate your ideas. There are a number of others which relate to how you cope with professional issues, and also how you can demonstrate a response to a clinical scenario. And it'd be worth looking at those and beginning to use your practice around those sorts of structures. I don't know if either Graham or Natasha have tried something like that and how it's worked.
I have a recommendation for a book, if I'm allowed. I have no affiliation with it, but I've used it for all my interviews, and it has exactly these structures in it, especially the management stations. If that comes into core surgery or later, they're very hard to structure. And I think everyone I know has virtually heard of this book. It's called Medical Interviews by Olivia Pickard, Dan Wood, Sebastian Ewan. It's the white with lots of, that's the one indeed, yes. Everyone I know has it. It's in every library. I'm not saying you have to spend money on it. I guarantee you will find a colleague who already has it. And I have gone back to this for my core surgical interview, my registrar interview, and my academic interview, because you can use those structures for anything. It's very helpful. And when you're panicking at the last minute, a structure is the most wonderful thing to hang things off. So I'd highly recommend that. I think Graham has something to say there.
I was just going to say that I should stress that was completely unprompted. We hadn't discussed that beforehand, but I was going to say the same thing. But I've used that book for every interview I've done in my surgical career.
It's very well written. I'm not even sure they even tried to do another edition, because it just well, but every library, I'm pretty sure, has it. So I highly recommend that. I think that's the only book I used for core surgical training. There will be lots of courses popping up, and they tend to all appear very near to the time of interview. So don't panic that there aren't loads around. So your hospitals will do them, regional ones will do them. Again, I didn't for core surgical training. I wish I had. I went on a number of them for registrar training, and lots of them just have practice sessions, which are the most helpful thing. And I taught on a core an introduction to surgery thing recently, and a great comment or quote from a consultant colleague was that if someone isn't making you sweat and stress during a mock interview, it's not going to be useful, which seemed quite harsh but really, really very helpful. I don't know if you have anything else to add, Graham.
I would agree entirely about what you said about the value of mock interviews, and I've run some of those for our foundation trainees here, and I've also had the experience of being on the other side of them with my senior colleagues when I was doing my registrar interviews. As far as courses go, I can't comment on those because I never attended any. And I would say that that's a personal thing. Some people have told me they found them incredibly valuable. I was lucky. I had people who were very willing to help me, but I think you cannot do this on your own would be the message that I would give from that, because it is a talking exam. It is not possible to do this well on your own. And if you have to revise on your own, which is sometimes a situation you may find yourself in, I would absolutely encourage you to record yourself doing so and then get used to listening to yourself and watching yourself on a video, because that is the way that you can improve on your verbal tics and on your non-verbal tics, because those are the things that can distract when you're answering questions. And with practice, you can teach yourself to control your speech so that you take away ums and ahs and uhs and that uncertainty. And it's something that does not come easily. It's something that requires practice, and it's something that you need to go through the unpleasant experience of watching yourself talk and speak out loud, because that really does make a huge difference. So whether you go on a course to do that, or whether you do that with friends, or whether you record yourself, that's the crucial thing. You can't do this on your own without talking.
Yeah, so as a practical tip, if everyone has Zoom, you just create a new meeting with just yourself in it and press the record button. It gets saved to your desktop. It's very easy and it's free, and you can do that. And there are loads of YouTube videos about tips for speech giving or public speaking, and they are all ones that will give you these tips of talking slow, which is something I don't do enough of, and pronouncing things correctly. And if you then take your video and show it to someone who you trust, either a spouse, a friend, or then maybe a senior if you're braver, because I'm quite shy with these sorts of things, and they can comment on your speech and whether you're presenting well and what you're doing. You can practice looking at the camera, the little red eye, because we usually just look at the screen, which means you're not making eye contact with the person on the other side of the screen, and that's quite a thing that's lost over internet interviews, I think. So practicing things like that. I've learned recently that you can learn anything via YouTube, so I would encourage people to certainly do that.
Traditionally, courses, the practice in courses has often been far more traumatic than the actual event, because you get the warts and all in that, because people are deliberately trying to put you off your stride. I would like to say that I think most interviewers and examiners are trying to make it as easy as possible. Obviously, they've got to get some information, but I think it's being done deliberately in a fair way as possible. Graham, I think, do you want to move on? Next slide.
So it may sound a bit silly, but when you're having a virtual interview, people can think about what not to wear. And obviously, again, treat this like it's a face-to-face interview. So I was not wearing a shirt an hour ago, but I knew I was presenting at this, so I went away and I put on a shirt. And if you are being interviewed, wear a shirt, a tie, and a suit. If you're a man, wear a smart blouse like Natasha. If you're a woman, make sure that you've brushed your hair, combed your teeth, shaved your beard, and then think about particularly what projects well on a computer screen. And these are some tips that have been provided actually through the college. And things like sheer shiny materials can reflect back off a screen. Whites can give a terrible glare. Black, you can kind of blend into your background, particularly if you have a black chair like I do. You can look like you're just a head, which is very strange. Loud patterns can be quite distracting, and anything that, because you're not face to face with the examiner, anything that means their attention drifts away from you is something that you don't want. You want to capture their attention and hold it for the duration of your answer, and that's quite important. And the point at the bottom, check for potential pitfalls in a test scenario, is crucial. So practice doing this beforehand, wearing what you are going to wear, because there might be a situation where something goes wrong, you need to stand up, and all of a sudden they find out that you're wearing like a tracksuit bottom or something, and it's not very professional. So you need to have practiced these things so that they know if you have to stand up, if you have to turn around, if you knock over a glass of water, you're still professional. You have turned up and presented yourself in a way that you would present yourself for a face-to-face interview. And that's, again, comes back to this fundamental point that you must practice. And I don't know if either of the other panelists have any other comments that they want to share.
I agree entirely. You need to practice with what you're going to present in. At least gone is the risk of going somewhere else to another city, having forgotten your suit, which has happened to a couple of my colleagues. Quick trips to M&S were required on both occasions. So at least you'll be near your wardrobe, but again, you've got to make sure that it works with the lighting that we might go on to talk about. And you're presenting, and also if you're wearing your power trousers and you're feeling great, but if you're going to sit down for a long time, that might not be very comfortable, especially if you're nervous. So the little things, I don't think anyone ever says, but I think it's important to note. And yes, the tracksuit bottoms or the wearing pajamas under your dress, not a thing to do in your interview in case you have to stand up. So also, if you're sitting in the back room at home trying to avoid the children, try and make sure at least it's a well-heated room so you're not freezing and your teeth are chattering by the end of it, which has happened on some meetings I've been on of late if they've been banned to the garden shed, which is great in summer, but not in winter. Otherwise, just like tips from me now, so my hair is brushed, I'm wearing a nice blouse, but you can see that when I move, the light is catching my necklace, which can be quite distracting. So I mean, that probably might not distract many people, but just those little things to think about. I don't know if Phil has anything to add.
Next one, please.
So this, again, it may seem like common sense, and I'm a technical philistine, so I'm probably the worst person in the world to give technical advice, but it's the same repeated message, which is practice. So work out what's going to happen if my internet doesn't work properly. Do I have another device if my battery runs out? Do I have another device if my camera doesn't work, if I can't log on? Have I tried to log on to all of those systems on multiple devices so that I know I can get to this interview? Think about your sound quality and your picture quality. So I'm using a device that I don't normally use to do this type of thing because I know the picture quality is better. I would much rather be using my laptop, but the picture quality is terrible, and that's not really fair when you're trying to do this sort of over the internet type of thing. Think about your background noise. Take yourself to the quietest place in the house if you can. Talk to the people that you are with and who might be in your house and explain to them that you cannot be disturbed, that you have to have really silent environment so that everything that you say is clear for the examiner. And again, this is something that you can practice, as Natasha has nicely described, using a virtual Zoom meeting with yourself. And coming back to the platform, download it beforehand, not a day beforehand, not an hour beforehand, do it a week beforehand so that if there's a problem, you have time to sort it out. Practice using it to have a conversation with someone so that you can work out how to mute yourself, how to switch your camera on and off, what happens as you move your camera around, and then think about what's behind you and things like that. Think about whether you need to screen share, think about how you change your speaker view, think about how you change your volume and your privacy settings. The better that you understand the program, the happier you will be using it, and it is one less thing to worry about during the exam or the interview. And it all comes down to how can you make yourself the most comfortable on the day. And for me, that is always by minimizing the additional distractions. So the better you are at using the technology, the fewer distractions that will cause for you. I don't know if there's much for Bill and Natasha to add, but there's another slide about your technical and setup for your internet space. So the next slide's maybe kind of useful for that.
The only thing I would add is that it's worth just checking if your both hearing and your own speech are good enough. Certainly in my own trust, doing patient consultations, it's far better to have headphones, because you may find that an interviewer asks a question, it's very difficult to say, could you repeat that please? You're losing time, and this is time is of the essence. So it's making sure that you can have a dummy run with someone talking to you, and talking to you either quickly, slowly, even with accents, because it can be challenging, and it's making sure those aspects are absolutely crystal clear. Both your hearing and what you're saying can be heard by somebody else. Carry on, Graham. Sorry.
The next thing I was going to say is exactly what this slide shows you. So the room that I am sitting in looks a bit like that bedroom on the right-hand side of the slide. If I turned the screen around, you would see that there's bicycles, there's an entire pile of Christmas presents, but the space behind me is a bookshelf with a load of medical textbooks. So it looks relatively professional. The light is in front of me, so my face is well illuminated so that you can see my facial expressions, and that helps build a rapport with your interviewer. There's nothing incriminating or embarrassing behind there, apart from some stuff to wash my bikes with and things, which is about all you can see. And I'm using a nice, comfortable office chair, which I know is well set up for me and which is at the right level for the screen. The other thing, and I think that the next slide describes this slightly, because these are all kind of the same issue, is talking about your screen level. So when you do virtual consultations, if you can get the camera at roughly the same level as your eye line, it's much nicer for someone to look at than if the camera is looking up like that. And so again, in this situation, I've propped my camera up. It's on 3 textbooks sitting up high, so it's at a reasonable height. And you can see Natasha's done something similar. Her camera is above her eye line, and that actually gives a much nicer picture to look at. And these are things that you just need to think about. And again, if you practice them, change little things each time you practice and see what works for you, what's better, what's worse. It all comes down to just trying to make sure that you have the best opportunity to present yourself in the best way possible. But certainly making sure that the space behind you is nice and clean and professional, that you're distraction free, a nice chair, making sure that everything's working. And then on the day of the exam, going through everything again. Sorry, it was the previous slide actually, Ed. Going through everything again. So what might you need? We've already talked about data, secondary devices in case something goes on wrong. Something to think about is whether anyone in your living situation, if you're living in a flat with flatmates or in a house with family, is using large amounts of data. So that's data downloads, data streaming, people playing games online, because that can massively affect your picture quality and sound quality. And you really want to make sure that there's nothing else on your internet stream on that day if you possibly can. Make sure you've got something to drink. Talking's hard work. Talking when you're nervous is much harder work. Make sure that you've got any documents or files that you might need. Make sure that you've checked the platform you're going to use, which is Microsoft Teams. Again, we've talked about devices being charged, plugged in, having secondary devices. We've talked about the camera position. And the other thing is, if you can be in a room with a locked door so that you can't have a situation where someone bursts in on you in the middle of your interview, I would thoroughly recommend that you do that as well. And I'm sure Bill and Natasha have little things that they've picked up from the webinars they've been involved in as well. I'm sure they can advise on those too.
Natasha?
Yeah, so I wholly agree with lots of those. Just had to apply them to myself. So for example, this evening I could barely get onto this because my husband's downloaded a new game, so I had to ask him to please reduce his use of the bandwidth. And that's, if you have teenagers, they might be quiet in their room, but they might be doing quite a lot on Minecraft or something, so you have to take that into account. If you have young kids, maybe get them off to nursery or over to someone else, your tier and lockdown allowing, just to make sure there's no distractions in the house. I am upstairs and my router's downstairs, so I've got a repeater in the room I'm in because it gives me a much clearer stream, and even I can figure out how to use that, and you can buy them easily online. So I'm not saying you have to, but if you find that you're getting cut in and out during different times of day, consider that. Practice at the time of day your interview will be, because one, for bandwidth, because everyone's working from home. So around where we are, our data, our internet is much slower in like the mid to late mornings, but actually a little bit easier towards the early evening. So just take these things into account and think maybe whether you need to go somewhere else. Also about the lighting of the day. So I'm facing my window, which is over there, which lights you up better. I also have a desk lamp where you can change the angle of the light rather than one of those fancy YouTuber lights in front of me, and that lights you up quite well, means you don't have any strange shadows. But it also means that in the mid-morning, if I have a video call in here, I can get blinded by the glare from outside, so then I can close the curtain and use the light in front of me. But that will come from practice at multiple times a day, or whenever your interview is going to be. It seems little and it seems very superficial, but you want to make yourself the best impression of the whole day, and little things like that do matter. Otherwise we wouldn't all turn up in suits on our interview days. Same as Graham, if you look over there, I've got all my washing, which you hopefully can't see because I've angled the camera correctly. And this lady at the bottom is specifically the YouTube video I looked at when I suddenly had to do lots of webinar meetings. And yes, exactly like Graham said, my laptop is on 4 thick medical textbooks. I finally have a use for them. Huzzah. Kumar Clark and Rangan Pharmacology. Excellent. They work brilliantly for this. I'm on my laptop, but again, yes, I usually have other devices around to make sure you can get on it. And as other colleagues have had problems with today, don't assume you can get on the platform in your trust, or that the trust internet will even work, because I had to trial this with a colleague at the hospital, and the internet was so slow we could barely make it working, which is why I had to drive home early to use my own internet at home once my husband was off his game. I think Graham's very expertly gone through everything, but those YouTube videos as to how to look good and how to set up your room, it's very easy. You don't have to buy anything extra, and it makes a world of difference to how you present yourself on the day.
Graham, next slide.
So again, similarly to what Natasha was saying, it's all about preparation. We've gone over and over and over in this. It's because I can't emphasize it enough. When you're actually talking, and I've tried to make an effort to do it, use non-verbal interactive cues. So it's the same as when you are doing an in-person interview, but it's harder. You have to concentrate. You have to look at the examiners the whole time when they're talking to you, and then you have to respond to them in the way that their body language is demanding. Try and ensure that you allow someone to finish what they are saying, because when people talk over each other on a virtual platform, you can get terrible interruptions in sound feeds. And I may have been guilty of that there when Natasha was talking about her Kumar and Clark textbook, which is exactly what's propping up my iPad. So that's very important. Try and look at the screen, or if you can work out where the camera is. I actually don't know where the camera is on this iPad. I think it's there, but try and talk to it, because it's all about that idea of how do you come across. And if you're in a real interview, you would shake the hand of the examiner, you would make eye contact, you would use their professional title, and it's the same thing. So you're trying to look at the screen, you're trying to make sure you make virtual eye contact, and you're trying to ensure that you engage the examiner, so that, again, you grab their attention, because it's a really long day for the examiners. They're there all day, sometimes 2 days in a row, and they're knackered because they're doing the same thing over and over again. It's very, very mentally challenging. And if you can get hold of their attention, then you'll do better in this interview. It's really, really obvious if you've got paper or notes on screen. You may have seen me glancing down from time to time because I've got the notes for the slides that we're going over. And I think that it's important that I tell you that, because it can be really obvious if you're sitting there with something in front of you and reading off it. That's a sign that you've not necessarily done the work that you need to do, because we expect people to be really well prepared for their interviews, And you should know that stuff. You should know what's in your application. You should know the answers because you've prepared so well and you've practiced so much. And if you glance away constantly to one side or the other, there's no hiding that when there's just your face on the screen. So things like your mobile phone need to be well away from you, that you can't touch, you can't pick up. You need to not have notifications going off on your devices, because anything that can irritate you or distract from your attention during the presentation is really, really obvious. And if something does happen, then I think there's a wee video below which you may or may not all have seen. I'm not sure if that plays or not, Ed, but the key thing is to stay calm. And as we've already discussed, staying calm is much easier if you have practiced. And the more confident you are in your ability to deliver the correct answers, the calmer you'll be able to be if something goes wrong.
Graham, I'm going to interrupt. I'm conscious of time. There's questions that have come through, and I think Jane's going to fire those at us. The one thing that we have not done is the latest phrase for 2020. You're on mute. So recognise that you understand how you can mute and unmute yourself, because
I think that's the next slide.
That's the final slide. I've interrupted it because I wanted Jane to throw the questions at us, because we've gone through this. So it's this year's phrase. So just be aware of that one as a pitfall. Jane, you've got some questions, I gather.
We have started to get some questions through. I was just guilty of accidentally having covered my camera over, which when I was just making sure that it was where I thought it was. So despite this being webinar number 28 or something for me, then I've made a rookie error there. We are starting to get some questions through. There's a variety of themes and topics. I'm going to do my best to bring them together. There's been a couple of people asking about, we've highlighted the need to know your application, and as a point of clarification, and I'm looking at Bill because I'm hoping that he will know the answer to this, is the core training interviews are, the portfolio score is coming from the self-assessment. Is that correct?
Yes. Yes. I mean, traditionally, you take your portfolio to the interview. It's reviewed by one of the examiners, because in fact, in that station, there's usually three interviewers. One is perusing the portfolio in detail while you're having the rest of the questions. Now, obviously, that's not practical, and so therefore, you will be expected to complete a self-assessment of your portfolio against a set of criteria. And to a certain extent, I think those criteria are published, and you should be in a position to do so, to do your own self-assessment, which is then submitted to the examiners.
So when we're discussing knowing about your application, are we referring more to when you're referring to things in your leadership and your management questions, making sure that if you reference your personal experience, that it marries up to what you've put in your application in that respect? Absolutely.
The one thing you don't want to do is to make a statement about something that has not been recorded. It's less obvious, obviously, when the portfolio is not available to the interviewer, but to make a statement during a discussion where it's not justified in the comments from your self-assessment is opening yourself up to some criticism. And so you've got to make sure, that's why knowing what's in your application, i.e. knowing what you said about on the self-assessment based upon your portfolio, is appropriate and consistent, because not knowing what you've achieved does not come across particularly well, because of course, don't forget, they will have your application form.
Brilliant. I'm sorry, I'm just trying to club them. This is another example. I'm looking on a different screen to read the questions because they come through in dribs and drabs, so my apologies. I feel like we all need to apologise for the things we're doing that aren't in the interview tips. So very quickly, could Natasha or Graham repeat the name of the book, please? There's been a lot of requests for the name of the book.
I'm sure Graham will put the book back up there. So if you just Google medical interviews book, this is the first that comes up, and that's the picture, and it's fair, and there's no other cover I think that looks like it, so that's all you need to do.
Okay, brilliant. Thank you. I'll also include it as in a note when we send the videos round later on. So we will put in a non-affiliated link to it. We've had a few questions about the presentation part of the core training interview, the management presentation. I think it's the management presentation. I don't know if anybody's got any feedback on that element. Given a 3-minute presentation on leadership.
Plan it and rehearse it, unlike myself, who thought that it wasn't that big a deal, and I just turn up and make it up on the spot, and then saw everyone revising their 3-page speech that they had been planning for weeks. It didn't even occur to me. So I'm sure Graham was far more organised than I was about that, but it's just things that I did. I thought that was cheating. No, plan it, present it, every moment you can.
Yeah, when I was doing my core training applications, I didn't have to do the same type of presentation, but my registrar training applications, I had to do a presentation in the national recruitment scheme. There were various topics, and you got emailed the topic a week before. You had time to prepare, and that's the crucial thing. You have to practice with any of these things, saying things out loud. You can be as clever or as plain as you want. There are advantages and disadvantages to both those strategies, but certainly practice and actually knowing the topic you're talking on is really crucial, because it's very easy to work out if someone is flying by the seat of their pants, and it comes across, particularly I think in a virtual setting, really clearly that they haven't practiced this. They don't know what they're talking about. This is just someone stumbling over something. Part of that comes back to what we were talking about with verbal tics, non-verbal tics, thinking about the way that your speech flows, remembering to talk slowly and look directly at the camera. And that's good presentation advice for life. Make sure that what you're saying is clear, well structured, and well rehearsed.
From the interviewer's point of view, it's very obvious when someone is doing what Natasha said she had done in comparison to people who have done all the background preparation. It is not cheating. It's giving you the best possible advantage that you can give yourself to score well in that particular station. And I can tell you that by sitting on the other side of the table, you can pick who's done it and who hasn't very quickly and very easily. And I'm afraid human nature is that it's almost a switch off if someone's sort of thinking that they can get away with this by winging it, as they say, because it is not good. And unfortunately, you will get body language back and it will put you off your stride. And so the preparation is crucial to make sure that your presentation is the best that you can manage.
Do you think
it's a reflection of you as an individual?
Do you think it would be fair, Bill, to say that that's another opportunity for the candidate to grab the attention of the examiner in a way we've been talking about? And again, it's a really fair interview. Nobody's trying to trick you or catch you out. It will be the fairest interview you've ever done in your career. But the examiners, by human nature, will get tired, will get disinterested, because it is hard mental work. So if you can have this it's an opportunity to sell yourself. Imagine you're on The Apprentice or something, and it's your sales pitch. So there you go out and really grab their attention, but you can only do that with practice and rehearsal.
It's the one station where that's absolutely crucial. To a certain extent, the clinical station is a test of your ability to cope with the clinical scenario. Now, to a certain extent, that's the exam situation, and I think many people in the straightforward things must make sure you're aware of what the common things are. So there are, I know, online questions that you can study up for, obvious things like complications post laparoscopic cholecystectomy. They're very straightforward things to sort through and be appreciative of that. But what the management one allows, and this is what the interviewers are looking for, they're allowing you to show what your potential is. And so, in other words, it's giving your own personality. It's your ability to show what you have done in a certain situation. And that's what the interviewers are looking for. You won't have the perfect answer to everything, but it's your ability to perform in this situation to show how likely you are going to be an extremely good trainee. And that's what the interviewers are trying to look for. So it's the ideal opportunity to try and prove that to them. Jane, next.
We are coming through thick and fast now, as is the norm with these sessions. We've also had people asking for tips about how to manage the clinical scenario questions beyond the A to E approach, which I'm going to confess I don't know what that is. So I assume it means something to all of you. But yeah, so just some general sort of advice on this, how you go about structuring your answers to the clinical scenario questions.
The A to E structure is really useful for hanging your answers on. So definitely don't go away from that. But you also need to know that and your CRISPR algorithm back to front, CRISPR being care of the critically ill patient, surgical patient. But you have to remember that they're only assessing your clinical knowledge at the level of a day one core trainee. So you're not expected to know everything. You're not expected to know details of your Bill will agree or disagree if I'm wrong, from your registrar level of FRCS. You need to illustrate that you are a safe clinician of an SHOCT1 level who can adequately decide if someone's sick or not, make basic decisions about some investigations in a sensible format, and be able to hand that over in an SBAR or similar fashion to your senior. They just want to know that if you're calling them in the middle of the night, are you sensible and have you assessed the patient appropriately, I think. But I'll hand it over to the more senior members of the panel.
One of the original themes that was set up when this was started with the MRCS exam was the ability to have exactly what Natasha's described, which is a telephone conversation, that you're ringing your consultant to explain the clinical presentation of the patient, what you've done, what you think might be going on, and what you're planning to do. And yes, it is round A to E, certainly, and you will find advice that says if you do it around that, you can't go far wrong. Well, up to a point. I remember one slightly difficult situation when the question in the exam, and it could be the same in the interview, tell me about rectal bleeding in a 45-year-old woman, and this chap launched into A to E. Airway bleeding, etc. Somewhat inappropriate for someone who come into clinic with those symptoms. So yes, you have to be aware of it, but equally you've got to put it into context. And again, it's the same sort of advice to the exam. Just think how you would do it day to day in your normal clinical practice, because that's, as Natasha said, it's that presentation, and then you've thought out in your own mind what the likely problem is and how you're going to manage it. Right.
I would just always say this idea of having a structure, but you need to use the right structure for the question. So a trauma patient or a critically ill patient, you use ATLS or CRISP kind of algorithms where you're doing immediate life-saving things. And encountering clinic, you're using your surgical sieve to come to a sensible differential diagnosis. And it's about working out which of your structures you apply to that question so that you provide a logical answer. And that's a really important thing. And that's where structure is really, really valuable. And the other thing is that you will get a question where you don't know the answer. And that will happen to nearly all of you, because some of you will be much better than I was, and you'll know everything. But you will find that there is a situation where you don't know the answer. And in that situation, structure will get you through that question, because structure will allow you to demonstrate that you are safe.
Okay. So we've got a couple more questions regarding the sort of presentation examples. One which I think is a very good question. Is it better to give one in-depth example or to show breadth via multiple examples of leadership and management?
That's difficult. I suppose in a way it's what you feel most comfortable with. What do you think is going to show your approach to the specific problem you're describing? Now, putting in more than one example could end up with it being slightly superficial. In other words, you're not going into the perhaps more detail of what we were talking about earlier with regard to the structured side of things, of getting some information in some greater depth and then working out what to do and what you've done to resolve the issue. If you have a whole series of different examples that are different, you'll start of just being fairly superficial. So I think, I don't know what Natasha and Graham feel. I personally would think I'd rate a candidate higher if they were going into some depth into a problem that they've managed. Graham, Natasha?
If you're not sure, I would trial both to your seniors, so consultants, senior consultants like Bill, and say, which sounds better? Which do you think do I present better with? That's probably what I would do, going along the theme of preparation. And you might get different opinions based on different people, but I think you'll get an overall idea of that sounds really good, or that sounds like you're not going into enough detail. So I think that probably be what I would do if I'm putting this.
Yeah, I would, again, that's exactly what Natasha said, practice. So if you have two different answers, you can be a bit like Boris Johnson and write your two different newspaper columns and see which one you like the sound of best. And then you'll come up with your conclusion. But I think in all seriousness, you've got to try and work out what the question is asking of you. So if it's tell me about a time when you displayed leadership, you only need to tell them about one time, but you need to really explain, why was this leadership? How did I display it? What were the results of that? What did I learn from that? It's an in-depth question, and you can say that I then applied this in a subsequent event where I changed my leadership technique or style, and that would be one way of demonstrating multiple types of leadership. But it's only something that you'll know the answer to if you practice it, and you can write down those answers, but you have to say them out loud again.
Okay, Jane.
Still coming in. So they're going to possibly start to be less clubbed together as we get through to the last few. Some slightly practical kind of questions. How would you? We've talked about the preparation side and making sure you know your application. If something's happened between you applying for core training or specialty training, and it's a very, very good example, but it's not necessarily going to be in your portfolio assessment, how would you recommend sort of handling something like that? Because I'm assuming that you wouldn't want to ignore something of value purely because it wasn't on your original application.
I don't think you should ignore it. I think it gives you an opportunity to show that you're progressing and gaining further skills or attributes. The obvious one that comes to mind is that you have just heard that a paper you've written has been accepted for publication, and you're very proud of the piece of work that you've done, and that will come across. And so it's something of that nature. I think it is a plus, because it demonstrates that what's in your self-assessment and what you say put in your application form, you actually continue to build. You're not just sitting on your laurels. And so I think there is an opportunity, if you can find the way of doing it, of including something that you think is a big plus that will boost how you want to put yourself across.
I think it's about how you phrase that, isn't it? So you would say something along the lines of, since submitting my application, I've demonstrated my ability to complete projects by submitting a paper for publication on this topic. And this taught me all of these skills which are applicable and transferable to my career as a surgical trainee.
I suspect there'll be a follow-up question, Bill, which is, can they, if they mention it, will it change their portfolio score?
Yeah, I take that one. I think that Graham's point about you can demonstrate you're a completer of project work is very important. It's a crucial skill to have, and it actually comes up at consultant interviews. Tell me what you want to do and have you done it, and what difference has it made? And it's a little bit like the audit cycle. So although you can't necessarily say, well, actually, I put this one in, I think I've got an extra point on my self-assessment, I wouldn't pursue that route. I'd leave it for the interviewers to take note of it, to say that, you know, this is something I'm very proud of, or, you know, it's made a difference. I completed a piece of work after 6 months. Obviously, it would have had an influence on my portfolio. Leave it at that. I wouldn't sort of put words into their mouth, because you'll slightly upset them, I suspect.
The examiners they're not trying to mark people down. They're trying to give you the best mark possible. So that's something to really remember. They're on your side, even though it might not seem like it when they're on the other side of the screen. But they are desperate to give you the best mark they possibly can, because people like Bill, and although Stella's not here, like Stella, they're really invested in you succeeding and becoming good surgeons, because eventually you're going to have to look after all of us as well. So making sure that, you know, you get the best marks possible is in their interests as well. So people are trying to help you. So always remember that they are genuinely on your side.
Definitely. So we've had a few questions coming in for recommendations, and because we are getting a little bit tight on time, I'm going to suggest that we can probably follow up with some useful links when we get back to people after this event. So just as a little bit of word of warning, I might be asking for some recommendations to the panelists. And likewise, there's been a few questions asking about some of the specific details of the 2021 processes. So we will clarify points with HEE, who unfortunately weren't able to join us tonight, and we will aim to follow up via email. If it doesn't come out with the first email, we'll follow up in the next day or so. So do sort of watch this space for those ones. Just now looking for the last couple that I was looking for. We've got a few more questions about tips for presenting yourself online, which is a little bit lighter than some of the terrifying clinical scenarios that you guys have to chat through. People talking a little bit about the nuance between a blank background versus, you know, if you can't find a blank background, are you okay to be in a sort of, I mean, I'm sitting, again, if you swung my camera around, you would see quite a lot of Christmas prep. But again, I don't have a white wall anywhere, so they're all full of stuff. So I don't know if people have got an opinion on that sort of thing to reassure people or not.
So I've had there are lots of these things about virtual backgrounds, but firstly, they take a lot of bandwidth to present well. And I think some of them are actually quite distracting, and they cover your border sometimes. And so I think it impinges on your presentation. That's my personal opinion. But I think generally, I have had attended webinars, taught on webinars, attended conferences where people have all sorts in their background, and I don't think it matters as long as it's not distracting above and beyond you, which I think part of practicing and asking other people's opinions, it's fine. I mean, some people have done it in their kitchen, as long as it's clean and you don't have your dinner hanging all over the place, that's absolutely fine. Graham had some shelves with some things that aren't medical on it, but they're not obtrusive, they're not getting in the way. I've chosen the plainest wall I have, but I have the luxury of that. I know lots of people don't. I would go against a fancy background because you're using a lot of bandwidth with your video call and you want that to go through your quality of video and sound rather than anything else additional to it. So I think it just has to be neat, static, and not distracting, would be my advice.
I would agree, and I think the background of the beach with the sunshine on it's not quite a good idea. It's distracting to the interviewers. It's trying to make it as neutral as possible. I think if you can avoid the bedroom, that's probably a sensible thing.
I'd echo what Natasha said about virtual backgrounds. Everyone is a little bit different. Personally, I find them incredibly irritating because they just distract me. And I think, you know, you are limited by what you have available to you. This is nominally the office in our house, but it's full of junk. But I've tried to at least set the screen up so the thing you can see is the bookshelf, which at least has some medical textbooks on it. So it gives the pretense I might have once read some of them. And I think at least trying to have had some thought about that, because it's not just about your background, it's about how you project on it. And that's to do with where your light source is, it's to do with where your camera is, it's to do with the clarity of your camera. So it's not just one thing, there's more than one thing to it. And the background on its own is not important necessarily, as long as it doesn't distract from the overall image and impression that you give.
Super, thanks. So I would, so I'm not in any way clinically trained, as you may have gathered, but having worked at the college for and produced these webinars for a long time, I would echo the issues with virtual backgrounds and the blurring. It can quite often, you think you've hidden something and it can suddenly pop up. So I would err on the side of caution. And like I say, I would stress the importance of being comfortable for these sessions, because although it's only your session is, one of the questions was about whether it was 10 minutes or 20 minutes, but you will be sitting waiting for your interview for longer than that. So you do need to make sure that you're comfortable and not distracted. I would say that would probably be my biggest bit of online presenting advice. I think we're pushing our luck a little bit, but if you're happy to take a maybe one final question. And then, like I said, we will follow up as much as we can with these. We're really aware of the urgency and importance of the questions you guys are asking. So we will follow up in the next couple of days and share freely the presentation and things so that you can access the tips and any resources. So I'm trying to pick the best one. We've got one very quick one, and then I might follow up with one last one after that, if that's okay. Somebody's asking a very practical question of what do you do if you know one of the interviewers, and is that a problem?
So I think you have to declare it. In my one, there was a consultant who worked in my trust, but we had never met, and they had decided that based on my CV and my application. So usually they've looked at it. I think Bill will confirm. I think you're meant to declare. They'll probably know beforehand because of where you've worked on your CV, and it's usually been sorted out beforehand. Because they specifically said to me, "We have clarified that you've never worked together. Is that correct?" And I said yes. So I think that's the answer, unless Bill has a different one.
No, it's the exam one's a difficult one sometimes as well, because if in that situation as an examiner, you may see someone coming towards you that you will know the names of those people coming to see you in an exam ahead of the actual event, and so their arrangements are made so you do not examine someone who's currently working with you. Now, if they have worked with you 6, 12, 18 months, 2 years ago, and you're not a formal referee, then it is entirely reasonable for you to continue to examine or interview. But it's highly, highly unlikely that you'll find yourself facing your boss.
And
I once had sorry, Jen.
No, you go.
I was just going to say, I once had I think it was a clinical interview where the interviewer actually came out of the room because they knew me, and someone else went in and replaced them. They knew in advance that I was coming, and they came out. They said hello, good luck, and then left.
Yeah, that's the standard approach from the examiner's point of view. That I've had trainees come towards the table at the exam, and I said, "Don't worry, I'm not doing it. I'm going somewhere else."
That was entirely the point I was going to make, is that they will be doing their best to make sure that they will make sure you're not interviewed by your boss, and they'll do their best to make sure that you're not interviewed by anyone who you've declared a sort of shared interest with, as much as possible. So one really is the final question, I promise. We've had a few people asking about leadership examples and expressing concern over not having recent leadership examples. Does the panel think that's a massive, massive problem, or is it more about how you frame your example?
I think I'll go Bill first.
Yeah, go on, Natasha. Off you go.
I as someone who came to core surgical interviews after having some time out in trust jobs, I don't think it matters when you had the job, the role, as long as you learned something from it and you've taken what you've learned into ongoing practice. So some people, I think, have had excellent answers from med school and even in non-medical roles. So I think as long as you can explain what you've learned and how you've taken that forward in your practice, I think there's no issue at all.
Agreed.
One of the things that I've come across is there is probably a specific type of generally man, a bit like me, who will come in and they will tell you about their leadership in the university rugby, hockey, football team. The examiners probably don't want to hear about that because you will not be the only one, and they probably want to hear about something that's a bit, again, it's your opportunity to grab their attention. So think about what you're telling them, and if you have something that is a little bit unusual, that's something that makes them sit up and listen. And I know certainly the Scottish orthopaedic training interviews for some of my colleagues, they said that they went in and someone talked about being the captain of the rugby team, and someone talked about being the captain of the hockey team. And my friend went in and talked about building a wooden boat that he then sailed down the Caledonian Canal on his own. And they said, well, that's real initiative, and you know, it really has crossover to orthopedics and things. And that was something that made him stand out. And he got a job and I didn't. So you have these opportunities to grab people's attention and try and think about what you're doing. And everyone has different life experiences, but you can relate most of what you do to medicine, because medicine is about people's life experiences, really.
It's back to showing your potential. So that's why non-medical things are entirely reasonable, because it's how you've gone about a challenge.
I think that's pretty much done, and we're now running quite late, so my apologies to the panel for keeping you here, but there were some great questions, and I was really keen to share them, so thank you.
So thank you very much for those who've attended. I hope it's been helpful, and thank you to my colleagues Graham and Natasha. Great answers, and of course thanks Jane and colleagues for setting it all up. And I hope we are able to, if you've not had your question answered, then we can do that by email and a summary. Thanks.
Thank you very much.
Thank you. Thanks.